Good evening, Mayor and City Council. This is Mary Rose Corrigan, Public Health Specialist with the City of Dubuque Health Services Department, here for another November 2nd COVID-19 update from our incident management team. And as a reminder, the Dubuque County Public Health Incident Management Team consists of myself, along with Dubuque County Health Department Director Patrice Lambert, Visiting Nurse Association Director Stacy Killian, Dubuque County Emergency Management Agency Director Tom Berger, and we work in conjunction with both hospitals and all the healthcare providers in full activation. And our team also consists of County Health Department Assistant Director Samantha Klopp and City Dubuque Health Services Department Environmental Sanitarians Tim Link and Cindy Moquin, along with our administrative support staff. Just tonight, I'm going to review the most important numbers to be watching, and these are listed here: the 14-day average positivity trend line, hospitalizations, the age groups affected, our epi curve, a look at the cases by zip code. We don't have our equity data related, but we, because the numbers can't be released, but we are monitoring that, and also long-term care outbreaks. There are many ways to define the average positivity rate and the 14-day average positivity rate. The incident management team utilizes the Iowa Department of Public Health statistics, which is reflective of the data we use every day. At this point, you can see we are today at 19.3% positivity rate, and the number is so far above the desired 5% or below rate. It probably doesn't matter which data point you're watching at this point. They're all high. Our hospitalization rate has also increased. These numbers, we are at 43 reported today, and this accounts for Dubuque County residents who are hospitalized. It does not account for residents of other counties or states admitted to our local hospitals, and that number is greater. The state hospitalizations are setting records every day, as most areas in Iowa are seeing increased hospitalizations due to the sustained increased number of daily cases. Hospitalizations account for daily total of Iowa residents and account for discharges and new admissions. As the White House Task Force reported, 97% of all counties in Iowa have moderate or high levels of community transmission, meaning they're in the yellow, orange, or red zones. And 57% of the counties have levels putting them in the red zone for high levels of community transmission. This is our overall epidemiological curve since March, or our epi curve. And the dates that are shown in black along the curve reflect the milestones of additional 1,000 cases we've hit along the way. And unfortunately, the epi curve is demonstrating the shorter time frames occurring between those 1,000 milestones. Another way to explain how quickly the cases are increasing is the days to double metric. Simply put, the doubling rate of an infectious disease or epidemic is referred to as the time taken for the total number of cases to double. And this doubling time can be an important factor for planning. This graph and calculation indicates our cases will double in 42 days. Although the 19 to 24-year-old age group has the highest number of cumulative cases since March in Dubuque County at 18%, the week of October 25th continues to show a trend towards a more even distribution of new cases in some of the other age groups, particularly that more middle-aged population. Our latest zip code data, I don't have it on a slide, but continues to show the zip codes with the city of Dubuque as having the highest numbers. However, when we look at it as a percent of population for each zip code, we see that many of the smaller communities also have high rates of transmission, and demonstrating that we indeed have countywide spread. And all of these zip code areas have increased in numbers and percentage since my last report. We again obtained another White Horse task force dated October 25th, since this is not really released public, but becomes available through various media outlets. And it maintains that Iowa and Dubuque County and the city of Dubuque continue in the red zone status. The three counties with the highest number of new cases over the last 3 weeks were Polk County, Dubuque County, and Woodbury County, which accounted for almost 22% of the state's new cases. The report states that all indicators of community spread are increasing, including the percent of nursing homes and positive staff members and residents, and community spread is increasing hospital admissions. Dubuque County's 4 long-term care outbreaks are also factored into this designation. So at my last report in October, I talked about what else can we do and what are we going to do to enhance our response efforts. I'm going to give a short update on where we are with some of those efforts. The VNA began and continues enhanced contact tracing for all new positive cases to a local connection. This is in addition to the Iowa Department of Public Health contact tracing. And they also assess isolation and shelter needs and provide testing information and notification of exposed cases through that contact notification. VNA continues to work directly with the pre-K through 12 schools and the higher education institutions to assist them with their contact tracing. All of the VNA staff is performing contact tracing, and they have scaled back on non-essential services in order to provide this function. Sadly, however, many of their calls to cases are met with anger and or a refusal to name close contacts. City Public Information Officer Randy Gale and his staff, in conjunction with the incident management team, will be providing new messaging and community education in conjunction with local healthcare providers to combat basically pandemic fatigue and address the community's lack of adhering to recommended COVID-19 safe guidance, and to make them aware of some of our healthcare provider challenges. City Attorney Krenna Brumrell is researching other mitigation strategies and best practices from local communities, and she continues to look at legal and ordinance options for our local city and enforcement. We also continue to do vaccine planning and get bits of new information every week from the Iowa Department of Public Health. We currently have 15 local providers that have signed the vaccine provider agreements with the Iowa Department of Public Health, and this encompasses over 25 vaccine distribution sites. So as mentioned in my last update, the police, fire, and health departments are working on enforcement, not only related to the city face covering requirement, but also for the provision of the governor's proclamation related to food and alcoholic beverage establishments, specifically the physical distancing, and other requirements in those establishments. So here to give an update on the police and fire department's efforts is Police Chief Mark Dalsing.
Good evening, Mayor and Council. Mark Dalsing, Chief of Police. So as you're aware that on August 10th, the mask mandate went into effect in the city of Dubuque limits. We started trying to track things at that point, but anything before that was a little more difficult due to the fact that there wasn't a specific code set up in the emergency dispatch protocol. So 911 Director Murphy made a specific task for COVID-related complaints. So anything that would have been before that date is not tracked in the usual method. So we've been doing everything since the 10th. And through 10/31, just a couple days ago, these are our numbers. So we've had 103 complaints under this COVID case type. So it could be, again, anything under the COVID proclamations or ordinance. And I will say the majority of them have been based on mass complaints. So there hasn't been a lot of change month to month. 43 in August, 31 in September, and 29 in October. But of those 29 in October, quite a few of those were officer initiated based on some of the other things we're doing. And as we look at the types of places that are being complained on, 88 are businesses, or 85%. 6 were private residents, 6%, and 9 public areas, or 9%. So businesses continue to be the primary place where we're getting complaints. To date, 5 individuals have been cited for the mass violation, and 1 business has been issued a municipal infraction due to repeat violations. Beginning on October 1st, we began doing additional outreach to businesses that showed up as a check, whether it was a complaint where the business was open and the officers made contact, or the business was closed and we checked in after hours. Sometimes we're a couple days later, but beginning October 1st, any business that gets a complaint, our crime prevention officer, Lieutenant Ted McClyman, is contacting the business and doing a one-on-one check with them, finding out what the issues are, where they're having difficulties, making sure that they have the proper signage. And for the most part, Ted has been very well received by the businesses. They've appreciated it and gotten their questions answered, and it's helped them move in the right direction. Seeing a need for additional work in this, beginning October 21st, we began working on an additional project between the police department, fire department, and health department to try to go in and inspect businesses from the standpoint of the governor's proclamation, where as far as social distancing and mass gathering type things inside of establishments. So just for a safety factor, the police department will be doing licensed liquor establishments, and the fire and health department will be doing generally non-alcohol businesses, but also businesses where alcohol isn't a primary issue. So the police department's gone out and done several so far. 73 alcohol licensed liquor establishments have been checked, and 63 or 86% have been found in compliance, and 10 failed, and they were reported to the Alcohol Beverages Division of the state of Iowa. And in those situations, the officers are going in either in plainclothes or uniform. They're making observations. And if it's a close one where, a table is 5 feet apart as opposed to 6 feet, they're giving the business the benefit of the doubt, but at least pointing it out to them. And they're going in, they're making contact, they're recording through video or photo, and they're submitting that to the ABD. For non-alcohol serving businesses or places where it isn't the primary alcohol being the primary part of the business, the fire department and health department are checking on those. And fire department has gone in on their first session last week and checked 26 businesses, and they found that the businesses were in compliance of the distancing. They had some mask reminders that they gave to the businesses, and keep it moving along. So some of the things that we're hearing as we're going into businesses, there's only been a couple that have been completely defiant about it. And as I said, one has been issued a municipal infraction. They're informed that if there's repeat calls to individual businesses, further consequences take place. But some of the examples, a very reliable city employee notified a small business that didn't appear to be in compliance. And when the officers went there, they found that the one individual did declare a medical exemption from the mandate. So we are finding situations like that. We're finding situations, one that I was reading through earlier today was a business that specializes in takeout. And the person working the phone had to remove their mask to be understood during the conversation on the phone. So working through small things like that, we're finding that the businesses are very cooperative for the most part, and they are using it as educational opportunities. And we are sharing the the signage and other information, including copies of the proclamation, if there are any questions. So again, the PD and fire and health are working on those. I mentioned the PD and fire, and I'll turn it back over to Mary Rose Corrigan, and she'll talk about some of the steps the health department has been taking in this aspect of it.
Thank you, Chief. The Health Services Department environmental sanitarians have responded to 13 citizen complaints at food and alcohol establishments not following the governor's proclamation. We've issued 2 warning letters to food establishments, those establishments without a liquor license, and referred 9 establishments with liquor licenses to the Alcoholic Beverages Division for enforcement. They have also monitored for compliance with the governor's proclamation during 51 regular food service inspections since we started this enhanced effort. And those are also done by the Health Services Department staff. We also do it on other inspections, including tattoo parlors and swimming pools. So that concludes my update tonight, and I'd be happy to answer any questions you would have.
Okay, thank you very much, Mary Rose. Anyone have any questions?
Yeah, Mr. Mayor, Brad Cavanaugh here.
Mr. Cavanaugh?
Well, thank you. I'd like to just take a couple of minutes here to just say a few things. I've had a lot of time to think about all this weekend, obviously, and just have some things written down here I just want to share, and might come to some questions here at the end that we can discuss. But first thing is first, I want to thank Mary Rose, as always, and everybody who's working in the public health community. Thank you to the City of Dubuque staff, Chief Dulcing, for your update tonight. And then thank you to the entire healthcare community for all of the work that you're doing to respond to this pandemic. I have to be honest, this week was a bit surreal for me. I started the weekend worrying and praying for a very good friend of mine who's contracted COVID at an essential job and has become very sick. And also watching my wife leave for work in nursing scrubs for the first time in 10 years. My wife, Jen, works as a director of a department in a hospital here in town. And she doesn't do direct patient contact and direct patient care, I should say. But this weekend, for the first time since the pandemic started, the hospital was facing a surge of COVID patients that was so large and so many nurses were out sick that Jen had to work 2 16-hour days this weekend to help COVID patients stay alive and to heal. And then I ended my weekend looking at pictures on social media of people cheek to cheek at Halloween parties in bars all over town, crowds of parents standing right next to each other at their kids' sporting events, and an event at our airport where 6,000 people were standing shoulder to shoulder and shouting and cheering. It was pretty clear to me this weekend that we really are on our own as a community to figure out how to finally get control of this virus. And if we do not, our healthcare system will not be able to keep up. That's the reality. If we want the same care that we've been able to get at our local hospitals, if you have a heart attack or break your leg, then right now is the time to get serious about this pandemic. And right now, it is the worst that it's ever been in Dubuque. I mean, the numbers are staggering. It's over 2,300 cases in October and 17 deaths in Dubuque County. 61 people in Dubuque County have died, and over 1,700 in Iowa. It's now the 3rd leading cause of death in Iowa this year. So this is where I get to where I want to make a point. I mean, I really think there are 3 groups of people in this pandemic, in this community when it comes to this pandemic. The first is people who care about each other and have consistently done their best to keep this virus from spreading. They're already doing their part, and thank you for that. The second group of people is people who live, work, and play in Dubuque, but don't really care that they live in a society in general. They don't really care that their actions are going to harm others, and no message that we send about how to slow the spread is going to get through to them. The final group is the group that we really need to focus on reaching, and that's where I want to make this point tonight. We need to reach them right now. This group is good people trying to do the right thing, but they don't know the full story. They don't realize that we have reached a critically dangerous time in this pandemic. They may be spreading this virus and not even realize it. And if they did find out that they would do whatever they could to stop it. So I have 4 things that I want to ask tonight, and this is just for everybody. The first goes out to hospitals, hospital administrators, doctors, nurses, healthcare workers. Please speak up. please speak up and speak out and spread this message as far and wide as you possibly can, more so than you've been doing so far. Please tell our community that we have to act right now. We need to hear the truth from you, and reasonable people will listen to you. They just don't have the whole story, and they need it. Business owners, we heard about you tonight a little bit. Please educate all of your workers and customers on how to control this virus and enforce these social distancing measures and masks. We're not doing them for the fun of it. It's because we can stop this thing. Your entire livelihood is at stake in this. Next message is for Governor Reynolds. Please help us. I'm begging you at this point as a city council representative here in Dubuque. You hold the keys to stopping this, so I'm begging you, Governor Reynolds, to please use them. And I hope you can hear that message. And finally, this is for my city council colleagues and City of Dubuque colleagues. I think now is the time that we need to take the next steps to get our message to reach that group of people that I was talking about, those folks who care, they want to do the right thing. And I think it's time for us to take whatever legal measures we can to slow this virus. We've passed a mask mandate. I want to explore other options that make sense and that a community could help us to follow. So we can get control of this thing in our community. Plenty of other places have, and I want us to do it now. Thank you, Mr. Mayor.
Thank you. Comments. Thank you.
Mr. Mayor, if I may add one
Yeah.
comment, I kind of skipped over a very important point in some of our enhanced work we're doing or what we're doing looking ahead. The incident management team and some city staff are working with Mercy One and Unity Point Finley Hospital on hospital capacity planning. Our hospitals are challenged by three main factors, one being the number of COVID-19 patients, two being staffing challenges due to illness, isolation, and quarantine issues, and three, equipment and supply chain limits for some items. Now, the entire state and country are experiencing these same issues. In fact, prior to this pandemic, there was a healthcare worker shortage across the country. So the governor's office and the Iowa Department of Public Health have indicated we must do our own hospital capacity planning, along with the regional state system and surge partnerships within communities and their corporate systems of the various hospitals. The Iowa Department of Public Health and the governor's office have indicated the state cannot supply staffing or equipment for any kind of a field or temporary hospital. This is not to say that absolutely no state or federal level resources will be available, but with the increase in cases in the US, there will be a high demand for any federal sources. So we are having regular conversations and beginning planning on how to maximize the use of our hospital and clinical space within the community, being creative with staffing and other issues. So we're beginning that work. But rest assured, our hospitals are not beyond their capacity, and they are welcoming our assistance to plan for maximizing their usage in Dubuque County. So we are working on that issue, and thanks for bringing that up, Mr. Cavanaugh.
Okay, does anyone else have any comments or questions? Okay, well, I tell you, Mr. Cavanaugh, I totally agree with your comments. I want to thank you for making them, and you know, I would hope that the rest of the council feels the same way. That you know, you're living this every day with your wife's situation. Many other households in this community are living with that daily contact with COVID patients because they're in the healthcare field. And we, as a community and as a society, need to look to those people and give them whatever care and help that we can, you know, to suppress this outbreak. I mean, this is we're going into the flu season, and I don't think we've seen anything yet. If we don't start doing what you know, the professionals at the federal and global level are saying, you know, and follow those very simple guidelines to keep everybody safe. So thank you, Mary Rose, for that update. And